Sunday night, and then I'll get that to you. Okay? So I appreciate you being here. Hi, Taisha, Barbara, Ashley, Charmaine, and Darlene. Thanks for being here. All right, so I'm going to share my screen and bring up my review. Okay, this is where I plug in my notes of what I want you to be reviewing. Okay, so everybody see that?
Yeah.
It's the same cover sheet as the last two exams. Okay, 50 questions. We're covering weeks 7, 8, and 9. 75 minutes. Examples of what you need to know for math. And at the bottom of this study guide, I have given you math tips. Okay, ways to calculate your drip calculations, how to set up an infusion time, calculating doses. Okay, so you have all that. Okay, let's see. If you struggle with math, I also sent resources way back in week 1 that I've said at every review to go back and review those. Professor, one of our PEDS instructors, Professor Bogart, has a YouTube channel, and she has a YouTube tutoring session, okay, on simple math. So if you need to go back and review that, that's in week 1. Okay, students find that extremely helpful for basic math, calculations, setting up IV infusions, converting milligrams to grams, and all your conversions. So very helpful tutoring. Okay. I would suggest that you review lecture materials, lecture PowerPoints that I send every week. If you need to review the concept recordings for weeks 7, 8, 9, that would be good. I would also suggest your quiz rationales. I'm still trying to sort out quiz 5, why you're not able to see the rationales. I may end up just copying and pasting into a Word document the questions and the rationales. I'm still waiting to hear back from IT to see if they can help me figure out why you're not able to see it. Has anybody, or during this, could somebody refresh your exam quiz 5 and see if there's anything that you can see at this point? Can you go back and see the questions and your answers? If somebody could look at that for me and tell me if it's still unavailable for you. So your quiz rationales, your PowerPoints, your, let's see, your concept recordings, this review, the recordings of these.
I'm sorry, but on my end, it's not, you can't see anything.
You can't see it,
can't
still
see
can't see anything. Okay.
No,
All
ma'am.
right.
For the rationales, yeah.
Yep. Thank you for letting me know. I think I'm gonna
No.
put together a Word document for you guys.
Okay.
Week 5,
Yeah.
it works for me.
It does work for you?
Yes, week 5.
You went on
Yeah,
grades,
mine
darling?
does not.
The grades book?
Not on the grade book, I go on the module.
So if you go, wait, you can see the
Okay, I went through the
question.
grade book, so let me go through the module then, because I went through the
I have
grade
to
book.
go
that's
to
what-
the module to see.
Okay, one second.
But what's the issue was week 5?
No,
This is quiz 5.
Quiz 5.
Quiz 5 in week 8.
Oh, okay,
Right.
week 8. I'm sorry.
Sorry, it still says
Let me go back.
correct answers are hidden.
Yeah,
Correct.
it's still not
Okay.
working.
Okay,
Okay.
week.
Yeah,
All right.
it's not working.
All right. I'm going to create a Word document for you guys that has
Thank
the
you.
quiz questions, the correct answers, and the rationales.
Thank you so much.
You're welcome. Okay. So let's review. Let's go through these. Okay. So this is my review. I know I give you a blank review at the beginning, but hopefully as we go through the weeks, you take notes. Okay. So here's the things I want you to review with each concept. So let's start with week 9, week 7. So infectious disease prevention and control. Okay, we had a lot of quiz questions about that. So the rationales in the quiz for infection control will be very helpful. So review ways to reduce the spread of infectious diseases, including contact precautions. Okay, we went through a lot of that in the quiz. Remember that? We also went through in the quiz, in one of your rationales, ways to reduce incidences of healthcare associated infections, the HAIs. Okay, so I want you to review that. Okay, what's important with the care of clients with TB? What do you remember?
TB test, X-ray,
Okay. What about caring for clients with active TB? What things do we want to remember?
Keep the clients in his room.
Yep, keeping the clients, we don't want them wandering around in public. They only
Yeah.
should be
airborne,
leaving their room when they need to. Go ahead.
And leaving with a
airborne.
mask.
N95 mask,
Yes.
right? Remember droplet precautions. Okay, I want you to review droplet precautions. Remember the epidemiological triangle we talked about has 3 prongs to it: the agent, the host, and the environment. What's the agent?
The
The
virus.
disease or infection.
Yeah, whatever
Yeah.
is a bacteria, virus, chemical exposure. The host is who?
You.
Us. That
Us.
agent is affecting the host. Hi, Alan.
Hey,
Hey, thanks for
Professor.
coming. Yeah,
Yeah,
hi.
thanks for having it.
You bet. And the environment is whatever the environment is, right? Or is it a home setting? Is it a long-term care setting? Is it a hospital setting? How may the environment affect the way that agent and host react? We talked in class about the example of a COVID patient. Now, let's say the agent is COVID and the host is an elderly, vulnerable person in a long-term care facility. That environment of a long-term care facility increases the risk,
Mhm.
right? Versus other example I gave was a high school with healthy kids. Okay, it may be COVID, it may be a high school healthy kid. The environment is the high school. They may be much less affected or get less sick than, say, an elderly, just simply being elderly puts you at risk in a long-term care facility. So just be able to identify what an agent is, what's the
Yeah.
host, what's the
And
environment.
I have young kids, so you know when somebody gets a cold or a virus at school, then everybody gets it.
Exactly.
That's kind of
Exactly.
the
Exactly.
environment.
Exactly. And there's the agent. Is it a minor case of the flu or is it a major proper influenza? Who is that host? Are they healthy? Are they compromised? What's their age? What's their location? What environment are they in? All those things are going to affect how those 3 interact, right? And then remember the difference between epidemics and endemics. What are epidemics? Epidemics are when the expected count or the outbreak is in far excess of what was expected. That's an epidemic. COVID was an epidemic, right? We're endemic. I'm using COVID, but COVID has moved into an endemic level, meaning it's not going to be eradicated. It's always going to be around. But we have strategies like vaccines that can help, right? So epidemic versus endemic. The next concept was HIV, TB, and STDs. So I want you to have an understanding of assessment, diagnosis, treatment for each of these STDs. Okay, chlamydia. Syphilis, we talked about in more detail in class. Okay, how do you diagnose syphilis? How do you know it's progressing to a secondary stage? The only way you can know that is with a positive blood test, positive serology. What do we want to know about teaching with herpes or genital herpes? Who needs to be tested? How far do we need to go back? Do we need to communicate with prior sex partners over the last 30 to 60 days? Who needs to be treated? Then we talked about HIV testing. What was significant about the HIV testing with the 12-week gap? What was that? What did we talk about with that?
You could
It-
get a false positive.
Yeah, it's not gonna show up, I think, up to 6 months, I believe.
3 months,
3 months.
right? It may not pick up any positive tests for up to 12 weeks, right? Which is why we teach our clients that they need to be retested, rescreened in 3 months, right? Same, we talked a little bit about, oh, go ahead. TB. We've already talked about TB.
Mm.
What about the HPV vaccine? What do we review some teaching points about that? And really with all vaccines, it's not a guarantee that you'll never get hepatitis or HPV, but it certainly reduces the incidence of contracting it and maybe how ill you'll get. Right? We talked about that in class. Bioterrorism and disaster. What are the two types of disasters?
Mankind.
Natural.
Man-made
And
and
man-made.
Yep. What's an example of a natural disaster?
Hurricane, we're in Florida.
floods, earthquakes.
Tornadoes.
What about a man-made?
Fire?
Yeah.
Yep.
Fire, a shooting,
Yep.
bomb threat,
Pollution,
yeah, pollution.
water contamination, right? When we're in the prevention stages, in the preparedness stages, we're a community nurse and we're teaching families how to prepare. What do we want them to put in their disaster kit?
Food for 3 days.
Yep. How often are we going to look at the disaster kit for expired items?
Every 6 months.
Every 6 months. What else do we want families to know? 2 more things.
First aid kit.
Where your preparation kit is located.
It's located, yeah.
And
Oh, it's
what's the other thing we want families to be aware of? How to
Turn
shut
off.
off utilities. Right? Talked about that in class. Why do we do mass casualty exercises? What's the intention?
So that we can train the people before the threat actually happens? Before
That's
the
one reason.
disaster
Yep.
happens?
We can see how things go, how agencies coordinate, what work needs to be done for, let's say, better communication, better response times. It's an exercise. It's a preparation exercise. How well did we do, or how poorly did we do? Gives the opportunity for corrective action if you need it. That's why we do mass casualty exercises. How do we determine water is safe to drink?
I know that we can get water from water heaters. That water is safe. And
Well, we have to empty out water from hot water tanks and commodes, right?
mhm.
We have to
Boil
boil 3 to 5
Boil 3 to
minutes.
5
Fine.
minutes.
And what about the bleach?
And add bleach a little bit.
1
That
mil,
one, bleach,
16
1 ml of bleach.
drops per gallon, and let it sit for 30 minutes, right?
Okay.
And you can go back to your quiz rationale. I had it all in there.
Yeah.
Well, how do we care for a client that potentially has been exposed to a chemical?
Remove
You
all
wanna-
clothing and contacts.
How
that
do you remove their
contaminates
clothing? What do we use?
With
Tongs.
Okay, what do we do
Tongs.
what do we do with the potential contaminated clothing?
We put it in
Put it in
plastic
the
bag.
bag. Plastic
Bag 'em up.
bag.
Yep. What's our role? Nurse's role during the impact. What's the impact stage? What's an impact stage? when it actually happens,
It's
Yeah.
to
right?
firmly
When-
give direction.
Pardon me?
It's to firmly give it direction
Right.
and
In
to
the
make people.
impact stage, everybody is affected. We need to be
Mhm.
thinking about safety, getting people to safe places. Right? That's the impact stage. Everybody goes through an impact stage. Let's say you're in a facility. Let's say you're working with the elderly, or you're in a school. That impact stage requires us as healthcare workers to get everybody to a central place to safety. Let's say it's a hurricane or a tornado, right? We want to get people, let's say in those instances, to the center, right? It's all about safety during that impact stage. Okay, be able to identify some examples of foodborne illnesses, waterborne illnesses, vector-borne illnesses. We talked in class. Maybe foodborne is salmonella poisoning, right? Waterborne, let's say after a disaster, we always hear about cholera, giardia. Those are waterborne illnesses. Vector-borne illnesses, tick bites, mosquito bites, Lyme disease, right? Remember talking about that?
Mhm.
Yeah.
Yes.
And then review anthrax, smallpox, and sarin. What is affected? Is it your respiratory system, your integumentary system, your nervous system? Just have an idea of what major body systems those potentially affect. For example, sarin gas, severe respiratory, right? Smallpox, skin issues, because remember we talked smallpox, those red pustules turn into, or that red rash turns into pustules, which turns into deep craters, right? Anthrax, skin issues, respiratory issues. So review those three. Then what do we want to know about home care? What's the difference between home care and home health care and acute care as far as location?
Home care is at the patient's home.
Mhm.
Acute care is at a facility or in a hospital.
Right. Home care is in the client's environment. What's important about home care assessment? I put in here establishing trust and collaboration. Why is that so important when you're caring for somebody in their home? Establishing trust and communication.
So they feel comfortable with you inside their house?
Right. You're their guest, right?
Yeah.
You're in their home. You're going to be establishing a long-term relationship or a relationship with them to carry out home health services. Right? This isn't going into a patient's room and, hi, how are you? I'm Darlene, and I'm going to be your nurse for the shift. No, you're in their home now. Okay, you want to feel comfortable in their home, and you want them to feel comfortable having you in their home. And that includes family members as well, or children, or parents. We talked about the importance of collaboration when it comes to transitions. Let's say you're going from acute care setting to home, or acute care setting to rehabilitation, or you're going from home to an assisted living, whatever the transition may be. Multi-agency collaboration is critical, right? Let's say you're transferring the patient from an acute care setting to home and they have requirements like oxygen or other medical equipment. They need PT services or aid services. All that has to be talked about before the transition takes place, right? We can't have a patient who needs oxygen not having oxygen at home when they get home. So the importance of collaboration with any kind of transition.
I was at clinicals yesterday at the med surge unit in the hospital. And the nurse I was assigned to was just talking about this,
Okay.
talking about the issues of I guess the service they use to the home step down where they get care in the home,
Mhm.
and that agency sometimes would just like call immediately and say, okay, we'll be there in an hour to pick them up. And she was complaining about how that's not enough time for her to, you
Mm.
know, get,
Organize everything.
yeah.
Yeah. Yeah. Well, that's why it is the multi-agency communication collaboration is critical to facilitate a smooth transition.
Everybody's got to be on the same page.
Everybody has to be on the same page. Like I said,
Yeah.
say you have a client who needs oxygen and they're being discharged and have half a tank of oxygen left in their portable tank. Well, they better have that oxygen sitting at the front door when they get home to be able, I mean, it's critical. The communication's critical. Importance of telehealth technology, how it relates to home care. What I mean by that is there's so many advances in technology that telehealth has become an important part of home care, where we may not have to get patients out of the home every time they have a doctor's appointment. Some can be done virtually or through telehealth, right? And especially think about the rural areas where patients can't get transported back and forth long distances. You know, telehealth plays a huge role in that. Review steps in the and interventions when doing a safety and fall risk assessment. What are your steps? What are your interventions? How do you do a fall risk assessment? What are you looking for? This is in home care, so assume you're in the patient's home.
Objects on the ground, throw rugs, dim lighting, rooms,
Railings on the
Furniture,
beds.
stairs, yeah,
Mhm.
the bath tub.
bath, bars in the bathtub, in the shower.
Mm-hmm. Mm-hmm. You know, just because let's say you're going into the home to do a wound check. Part of your assessment includes a safety check,
Yeah.
right? An environmental check, right? You're in their home now. You have to look at everything going on, even though you may be there to do a dressing change. What if they've fallen? What if you notice things that could potentially be at risk for fall? Your visit will expand way beyond a dressing change, right?
Mhm.
Review the differences, Medicare, Medicaid, Omaha documentation system. I didn't address this a whole lot in class. Just go back to your reading and read about the Omaha system. The Omaha system was developed decades ago for home health. And it was the original documentation system that brought everybody together. So PT could see what OT was doing. Home health could see what the physician was doing. Okay, so just have a look at that. I just want you to be familiar with the Omaha documentation system. And I put in parentheses, system was developed by visiting nurses in Omaha and based on the home health documentation needs. Since it's so multi-agency, right? A home health agency can involve so many entities. The system was put in place years ago by the visiting nurses and is still current. We refer to that as the Omaha documentation system. Okay, the big differences between Medicaid and Medicare. Remember, Medicare is your 65 and older or any age with disability,
Yes.
right? And your Medicaid is your based on financial needs, income based. But remember, home care is Medicare is very much involved in home care. And Medicare will only cover services that are skilled nursing services. So going in to do a dressing change, going in to do an IV antibiotic, going in to do medication administration. Skilled nursing care, that's the difference. They do not cover unskilled nursing care, which would be support for activities of daily living. Okay, so that's the big difference. Okay? With Medicare, requires skilled nursing care versus not skilled nursing care. Why is it important for community nurses who work in the community to know what your community resources are? Why is that?
Because we got to provide the resources based on the client that we're caring for.
Right. And each client we work with is going to need different resources based on their medical condition, their diagnoses, maybe their income level, maybe they're living in poverty and they need access to food banks or clothing banks. Maybe they're a victim of violence, domestic violence, and they need a safe shelter. Maybe it's a pregnant teen that you're working with that needs care, OB care, education. Maybe it's an elderly person with chronic health disease, a chronic health disease. They may need different resources. So the point is that if you're working in the community, you need to be very well educated on what resources your particular community has to offer. Do people need Meals on Wheels? Do they need the Red Cross? Do they need transportation? Do they need help with their animals? Do they need help with cooking? And then what do we do? Lots of our communities now are full of non-English speaking clients. What resources might be available to them? Well, that's where we reach out to our partners, our teammates in the community, our community trusted leaders, right? Let's say you have Vietnamese, a large Vietnamese non-English speaking population. Who in the community works with them? Are there Vietnamese leaders in the community that can help you get information out, maybe to families of kids who need immunizations or what they need for school supplies? Community nursing is all about partnerships. Who can you partner with in your community to help you attain your goals of a healthy community? Could be spiritual leaders, could be law enforcement, could be education advocates, could be food bank directors, Red Cross
Nonprofits.
leaders, pardon me,
Nonprofit.
nonprofit organizations. Yes. Who is helping the population settle into the community? Talk to them. How can they reach out to their group and get out the information you need to get to them that will help them with lots of different resources, or at least educating them on what resources are available. Maybe housing needs, financial assistance, food assistance. Okay. Case management. What does a case manager do? What's their primary role?
Coordinate care.
Advocate.
Coordination of care.
They're basically like the quarterback, right?
Yeah, they're the coordinators of care. It's a really hard, time-consuming, labor-intensive role. We wish we could case manage all our clients, but we can't. What kind of clients do we case manage?
Children,
Children,
elderly,
elderly, high risk, high cost, consuming lots of resources type of client. People with multiple chronic diseases that may need multiple resources. maybe multiple, maybe a mental health issue, substance abuse.
Hmm.
Right? Case management, unfortunately, we can't case manage everybody, so case management is usually reserved for your high cost, high needs, high resource utilization clients. Right? And then case managers use all different kinds of communication, right? We collaborate. Sometimes we have to be assertive in being advocates for our clients. We can cooperate and we can compromise. They're dealing with a multitude of agencies, multitude of resources to get accomplished what needs to be done for the client. So just be able to identify if a certain conversation is going on, what are they doing? Are they collaborating? Which is trying to come up with a joint solution that makes everybody happy, collaboration. Are they needing to be assertive? Advocating for their client, maybe with the client's insurance company.
Now, does a case manager, does it have to be a nurse? Or could it
Mhm.
be, it does, okay.
Yep, yep. Cooperation, we're cooperating to reach an agreeable solution, right? And then compromise, maybe it's not the best outcome that you would hope for, but between the two parties, you're both getting some of your needs met, maybe not all, you're compromising. Okay, we talked about how to establish trust in the public health programs before a crisis occurs, right? That's engaging your community leaders. Sometimes we've run into this issue with undocumented. They're afraid to come forward. I had this happen in the schools all the time. They're afraid to come forward and ask, where can I get my kid immunized? Where can I get to a food bank? Where can I get financial resources? Because they're afraid their immigration status will prevent them from being eligible for anything. And that's simply not true. Okay. We talked about assessing eligibility for home health services, but the need for being skilled nursing care is the most critical factor. Okay, that was back in our home health section as well. And then with regards to caring for the complex chronically ill, you have a list of complex chronic illnesses. I just want you to simply review how you would assess a client with that particular chronic diagnosis, how you would diagnose, and how you would treat. Okay, I want you to take a look at diagnosis, treatment of wounds. This is where your med-surg is coming in, right? What are the first couple of stages of wound healing, and how would you treat it? Delegation, we talked about that. If you were delegation as an LPN, you're delegating. What kind of client would you not delegate to a UAP?
One that just came from surgery or has had it in the last 24 hours.
Okay.
One that needs to be assessed, like to see how things are going.
Yep.
One you would not assign one who's not stable to the
Exactly.
UAP.
Yep.
One who
Yep.
doesn't know that work, like if they don't know how to do it, you wouldn't assign it to them.
Okay, so let me ask the next question. So as you're delegating, what do you have to make sure whoever you're delegating to you knows?
They are
And to
trained.
make them do it. I'm sorry, go ahead.
Sorry, they are well trained because they are
Okay.
they are
Let me
under
ask
the
more
first
specifically.
license.
Let's say you were delegating a dressing change. We would want them to know how to do it,
Yes.
right?
We would want them
What
to do
they
a
would
teach back.
need to do,
Teaching, yeah.
what they would need to notify you of based on concerns.
Mhm.
and what they need to document.
Yeah.
Remember, they are under your license. You better make sure that they know what they're doing, how to do it, what they need to document, and what they need to tell you. Right?
Yes.
Okay. Oh, and here's review the nursing process when planning care for what is cirrhosis. Just think of it like your HESI prep. What do you need to know about cirrhosis? What care for what they may present with, how to treat them. Same with COPD, diabetes, PAD, chronic venous insufficiency, hypertension. Okay. So just go back and review your notes. If you need to go back to your Med-Surg book and review those little snippets of pages for each of those, go back and review that. Okay. And this week we covered human abuse and violence. Different types of violence, give examples. We talked about domestic violence, intimate partner homicide, child abuse, child neglect, elder abuse, elder neglect, suicide, violence against yourself. Okay, we all know why we are mandatory reporters. Okay, what are the most common factors in intimate partner homicide? Okay, the most common factor is there's been a previous domestic violence incident, right? What do we think some risk factors are for suicide?
Age under 40,
Mhm.
female,
Drug abuse.
Pe-
a
People who
history of
suffer
that.
from
Them talking
depression,
about
Depression,
depression,
Financial issues.
substance abuse.
yep.
talking about carrying out
Mhm.
carrying out the act.
Yeah, what do we want? What do we want to ask? Do you have a plan? Do you have the means to carry out your plan? Have you tried this before? Risk factors for kids who are exposed to violence, along with observations when suspecting child abuse or neglect. Talked about this in class. What's the difference between physical and emotional neglect? Physical is your basic needs, right? Food, clothing, your basic needs. Medical care, food, clothing, shelter. Emotional, not being present. Right? Not being tuned into growth and development, emotional needs, nurturing needs. What are some types of elder abuse?
Financial.
Withholding care.
Financial, physical, emotional, right? And we all can talk about
Neglect.
examples of each of those, right? And then the last was the cultural influences. Again, I think we've already answered this question. Review ways to build trust with non-English speaking clients. How do we effectively communicate? We just talked about that. Seeking out your teammates, your trusted leaders in the community who work with these populations. They're an excellent facilitator of helping you get information to these populations. What does it mean to be culturally competent? How do we get there? What's the first part of cultural competence? The first part is cultural awareness. What's cultural awareness?
Knowing what
Being
you feel
aware of
about
your
the
own.
situation, of your own beliefs.
Exactly. Exactly, Brittany. You've got to do your own self-assessment. Right? Do you harbor any prejudices, any biases, any judgments against any particular cultures or populations? And if you do, that has to be sorted out before you're going to be able to provide culturally competent care to a particular culture. Cultural barriers. We just talked about a couple of cultural barriers. You know, maybe it's a language barrier. Maybe it's a belief system barrier, right? But we have to have our own self-cultural awareness before we're able to provide culturally competent care. And lastly, in order for us to be culturally competent and practicing as a culturally competent nurse, it's simple. We have to be able to see the client through their perspective, taking into account their values, beliefs, practices, healthcare thoughts. How do they deal with end-of-life issues? How do they deal with pain management, touch, personal space, food preferences? We have to be aware of all of that before we can, and accepting of all of that before we can provide culturally competent care. It's that simple. And you know, you will develop cultural competence through your entire career. I've been in nursing for 40 years. I'm still educating myself on different cultures and how to be culturally competent. I have done my self-evaluation over the years of if I have had any issues with anything. I've had to teach, work through, whatever. And there hasn't been many. But I have to see the world through from a different cultural perspective. You're going to be working with different cultures your entire career, irregardless of the area of nursing you work in. Right? And it's a learning experience throughout your whole career. Embrace it. It's actually awesome to learn about different ethnicities, different minorities, different cultures, whether it be in the schools, in the hospitals, working with different kids of different cultures. It's truly it's a ongoing experience that you'll be working with both personally and professionally. So that's what I think that you need to be prepared for the exam. How's that?
I have
Okay.
a question.
Yep.
Where can I find these concepts on the announcement?
Be more specific.
The review that you just showed us?
Yep.
Where
Nope.
can I?
Nope. That's fine. Those are my notes.
Oh,
Those are my notes.
okay.
Because remember, I give you a blank one, and
Yeah,
hopefully,
that's what I was trying to see.
my hope is that as you've been taking notes the last 3 weeks, a lot of what I have put in those boxes you already have in there. That's my hope. But
Yeah,
no,
where
I don't share.
find
Those
it
are
from.
my instructor notes. It's just kind of for me, it's
The blank one.
but now you can fill
The
it in.
blank one
Yeah,
is
no, I
marble.
don't share that. I like to pull that up in my review, but no, those are my instructor notes, and hopefully it's a starting list for you if you already, hopefully it's not starting, but it's a reminder of what to review. It highlights the important topics within each concept that if you have a good understanding of, you'll be absolutely fine on the exam. Fine.
No, my question was, where can I find the blank one?
Oh,
Do you
I
have
sent
it?
that for
Did you
this
put it on
particular
the
exam. It was sent out in week 7. I sent it out in the first week of when the exam's going to be. So for example, exam 1 review, I sent out in week 1. Exam 2 review, I sent out in week 4. Exam 3 review, I sent out in week 7. That's where you have it for the weeks that we cover. And I always say in week 1, pull out those exam reviews when you're in class and take notes on them. Okay. Does that answer your question?
Yes.
Okay. Well, I appreciate everybody coming today. I hope this was helpful. You'll get the recording, hopefully this evening or first thing in the morning. I'm gonna work on my quiz 5 information that I need to get to you. And then reach out to your professor, whether it's me or I know I have some other students in here, before you take your exam, if there's any concepts you're still struggling with, okay?
Okay, thank you so much.
All right, hopefully this is
Thank
helpful.
you, Professor Marvel.
Thank
Have
you,
a great
Professor Marvel.
weekend.
Thank you.
All right,
Thank
bye
you.
guys. Have a great weekend.
You
You
too.
too.
Okay, bye.
Bye.